Hi everyone, welcome back to your last video of this week lecture. So in this video, we're gonna discuss on the steady state concentration or known as CSS as well as the maintenance dose and loading dose. Steady state concentration is the situation at which rate of drug administration is equal to the rate of drug elimination so that the amount of drugs remain constant in the therapeutic range as you can see in this diagram. So this is the therapeutic range. MEC refer to minimum effective concentrations and the MTC refer to minimum toxicity concentrations, which means that if the drugs below the MEC doesn't give any therapeutic effects. Meanwhile, if the drugs exceed the therapeutic range, which is more than MTC, minimum toxicity concentration, it can cause toxicity or adverse effects. So, uh, I would like you to emphasize on this chart. We're going to focus on orally drugs that follow the first order kinetics. So the time of half-life is on the x-axis, meanwhile the serum drug concentration along the y-axis. Now, if the patient is given one dose of drug X orally, the serum concentration will increase until it reaches its peak concentration and proceed to decrease as the drug is cleared from the body. At one half-life of the drug interval, the drug concentration will be one half of the peak concentrations, which is the 50%. Now, if we continue the dose of drug X every half-life of dosing interval, the drug concentration will continue to rise and fall, ultimately increase until it reaches a certain point where the average drug concentration remains stable. So we refer this concentration as the steady state concentration. I would like to emphasize again, during the steady state concentration or known as CSS, the drugs enter the body is equal to the drug leaving the body. So usually in practice, it required steady state to achieve after 4 to 5 half-life of time the drugs being administered. So as we mentioned before, we are looking at the concentrations when the drug coming in equals to coming out, which can be further translated into this mathematical equation as shown here. So there are three factors that determine the amount of drug entering the body, which are the dose of drug being administered, represent the D value, the bioavailability of that drug, which is the F, as well as the oral dosing or frequency at which the drug is being administered, which represent the tau value. This is tau, is not T. So for drugs leaving the body, it depends on two key factors, which is the first being clearance. And if you can remember, in the first order kinetics, the drug clearance is proportional to the drug concentration. So that the second factor is going to be the drug concentrations. So to calculate the steady state concentration or CSS, so this CSS can be calculated using this equation that derive from above equations. So the next concept that we are going to be discussed is maintenance dose. So maintenance dose is the dose required to maintain the steady state concentration. Essentially, it refers to the amount of drug that need to be administered to compensate for the clearance of the drug from the body. So maintenance dose refers only to the drug administered, not the drug entering the circulations. Thus, we can calculate maintenance dose by using these equations by transferring the bioavailability to the opposite side, which they need to divide the bioavailability. This is the dosing rate. When dose divided by tau is the dosing rate, or also known as drug regimen. To calculate the maintenance dose, the dosing rate need to times with the dosing intervals. Here is the examples. Calculate the infusion rate, which is the dosing rate of drug Z that required to obtain the therapeutic concentration of 10 mg per liter for a 70 kg patient. So this therapeutic concentration is equal to steady state concentrations. So the clearance of drug Z is 40 ml per kilogram per hour. So means that they need to calculate the dosing rate by using these equations, which is the clearance time with the steady state concentration divided by the bioavailability. So put all the data here. So the clearance, which will be the 40 ml per kilogram per hour, times with the 70 kilogram the body weight of the patient, because you need to cancel the kilogram value in this data, time with the 10 milligram per liter, which is the target steady state concentration, the therapeutic target concentration. But don't forget to cancel out the liter, the volume, since the liter mml cannot be cancelled once and another, so you need to convert the liter to the ml. So 1 liter equal to 1000 milliliter. So that's why you can come up with the 0.001 based on this 1 divided by 1000. So you can convert the value, so you can cancel the liter as well as the milliliter value. So therefore the infusion rates would be 28 milligram per hour. So following from these equations, from this data, the clinicians or the doctor want to maintain his this plasma level using the oral drug Z. So from the IV infusions, they want to change to oral drug Z. Might be the patient is already be outpatient patient, so which might be given every 12 hourly. So the bioavailability of the oral for drug Z is 0.96. Calculate the maintenance dose for this patient. So how to calculate the maintenance dose? So from the equation that I have mentioned before, dosing rate times with dosing interval, but don't forget to divide with bioavailability. Why you need to divide the bioavailability? Because of you change the drugs administered route, which from the IV infusions convert if to the oral drugs. So that's why you need to divide the bioavailability. So from these equations, you manage to get 350 milligrams. So a tablet or capsule that size close to ideal dose of 300 milligrams will then be prescribed every 12 hours intervals to this patient. If you remember the steady state concentration that I have mentioned before, it takes about 4 to 5 half-life to reach a steady state concentration. It is acceptable for the drugs that are having short half-life. However, it is contradict, especially in the situation when the drug has a long half-life. Example, amiodarone. So amiodarone has half-life about 110 days, which are not feasible to wait 440 days or 4 to 5 half-life in order to achieve the desired steady-state concentration. So in these situations, we need to administer a one-time dose to prime the patient. This is the term of the loading dose. So the goal of loading dose is simply to reach the steady-state concentration in a shorter period of time. Unlike the equation that used to calculate the steady-state concentration as well as the maintenance dose, where the drug has already been distributed throughout the body and has reached the desired state concentration, which the drug in is equal to drugs out, the equation for loading dose focus on the patient has yet to reach the desired steady-state concentration. Therefore, the volume of distribution is important for determining the loading dose, opposed to the clearance that used in the maintenance dose. Example, calculate the IV loading dose of drugs X that required to obtain therapeutic concentration of 30 microgram per liter. So this is the steady state concentration for a 70 kilogram patient. So drug X has a VD of 0.75 liter per kilogram. The clearance rate is 1.20 milliliter per kilogram per hour. The half-life is 12 hours. The bioavailability is 0.85 oral, and target concentration is 20 to 40 microgram per liter. So the clinician target of the 30 microgram per liter instead using the lowest or the highest concentration of CSS. So using the loading dose equations, which is the volume of distributions time with the steady state concentration divide with the bioavailability. So the volume of distribution is 0.75 liter per kilogram. Don't forget to times with 70 kilogram to cancel out the kilogram value in the data, and time with 30 microgram per liter, since these both are liter, so you don't need to convert it to milliliter. So you can manage to get 1575 microgram or 1.575 milligram. So here another example, calculate the dose of drug X that required to obtain target serum concentration of 30 microgram per liter with dosing twice per day for a 70 kilogram patient. So this is the drug X information. The volume of distribution is 0.75 liter per kilogram. The clearance rate is 1.2 milliliter per kilogram per hour. The half-life elimination of half-life is 12 hours, and the bioavailability is 0.85 for the oral drug, and the target concentration is 20 to 40 microgram per liter. So when the one the dose is referred to the maintenance dose. So using the maintenance dose equations, which is the clearance time with the CSS and divide with the bioavailability. So the clearance rate is 1.2 milliliter divided with per kilogram per hour. Don't forget to time with the patient's body weight 70 kilogram, so that you can able to cancel the kilogram value in the data. Time with 12 hours, which is the uh, elimination half-life to get the clearance, and time with 30 microgram per liter, which the target concentrations. And don't forget to convert the liter value to the milliliter value by times with the 0.001. So you can able to get 35.576 microgram for every 12 hours. So this is the dose. You need to find a capsule or any tablets that represent near to 35 microgram or 36 microgram. Alright, that's all for to this week lecture. If you encounter any problems or inquiries, you can directly WhatsApp to me, or you can email to me. Alright, thanks everyone. Stay safe and good luck.